Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I get to talk to Samantha Reader live at the health conference in Vegas. So Samantha is a physician and entrepreneur, and she's going to share with us about her background as well as what she's building to make healthcare better. So Samantha, thank you so much for taking your time in this very busy conference to share your story with me.
Thanks for bringing me on. This is great.
Yeah. So tell us about your background. What brought you to this point in healthcare?
So I'm an emergency medicine physician by trade. I'm still a practicing emergency medicine physician. I'm also a Navy veteran and I have 2 kids. And I've had many injuries in my life. So I've been active and I've been a fitness athlete for a long time. And so kind of bridging my 2 loves and the 2 things that I've experienced, I created Bounce Back Smart. So with my background, I see people injured every single day. I see them sidelined. I see them losing confidence in themselves and losing confidence in their fitness and wellness journey. And it breaks my heart. And I've been there. And so I wanted to create something to change how people recover from their injuries confidently.
Awesome. And then what is it that you have made in Bounce Back Smart?
So it's an AI-driven, physician-trained adaptive fitness program. It's an app that takes into account your injuries, your restrictions, whether you're pregnant, postpartum. It takes into account if you have that chronic ache in your shoulder that just bothers you and keeps you from the gym today. And it adapts to you and everything you love about fitness. So if you like functional fitness or lifting or Pilates, whatever you like to do, it looks like your workouts so that you can continue progressing safely. And then it takes into account those injuries and restrictions from your PT and your physician so that you can safely keep exercising, knowing that you're safe with your restrictions.
That is so wonderful. And I just love all the technological solutions that can be built based on our own human experience. So I'd love to ask you, for those who are listening, who maybe are a clinician and they have ideas, but they didn't teach us in nursing school or in med school, how do you build an app or how do you build an AI solution? Like these are new things. So how did you get into this? Like what was your first step?
I will tell you that it's been one of the most overwhelming and exciting experiences, having gone through school and traditional training, Socratic method, typical training that we all go through. It's been a very different experience this year. But there are so many wild tools out there so that you, as someone who's never trained in AI, as someone who's never created an app and know nothing about that world, can learn about that world. You can vibe code, which is wild. If you don't know what vibe coding is, it's an AI that you talk to and it creates the back end code. You can create your own apps. Your kids can create their own apps. It's been amazing. So I actually did that myself. I vibe coded and created my own AI through the AI services you have, and you can do that. And then you can optimize them by further training with more experts.
Yes.
But you can create your own AI even on OpenAI if you just want to advertise more, do different things. And it's a really amazing tool that clinicians should be using because you don't just use the regular chat GPT, but you create something specific to you and your goals. And so I was able to do that. And I think everyone can if you just kind of get a little gritty and scrappy and try it.
It really opens up your possibilities. And if you're not sure what AI can do to help you, you can ask it. Right?
100%. I use AI to tell me how to use other AI.
Exactly. And you alluded to this, and we talked before this interview a little bit, and you were talking about how you basically built like your prototype or the demo of what you wanted through vibe coding, and then you consulted with experts to really build and flesh out the tool further, right? So what was the next step after you had your demo? How did you find the people to work with?
Yeah, so I researched people who were designing in similar spaces. So the app I'm creating doesn't really have a space for it. It's neither fitness nor physical therapy.
Yeah.
It's kind of in between zones.
Yeah.
So I was researching people who were good at creating HIPAA compliant, medically compliant programming, even though we're not really in the medical space. And so that was a great direction to go to make sure we're as safe as possible.
Right. That way, if you want to go in that space, then you've already got the protections
we're
built
sort of
in.
safe there. Yeah. And, once again, you can use AI to find these things and saying exactly what you need. It can help you explore worlds. So I interviewed maybe 10 different groups that are, HIPAA compliant, medically compliant, and then who was making beautiful apps because I wanted to be beautiful.
Right? We don't need ugly apps.
You know,
No, we're at a conference right now. If you're just listening to the audio version of this, you can't see it. But if you're watching the video on YouTube or Spotify or something like that, you can probably see this beautiful backdrop for health, which is HLTH. It is a conference that brings together innovators of clinicians as well as tech companies, as well as device companies, but mostly tech, it seems. For example, there's all kinds of solutions being put together here. We had a nurse hackathon this morning. I participated in it last year and just kind of went to take pictures this morning and see some of the amazing ideas that were happening. But this whole place is so full of people who have great ideas, finding the partners to work with to make them come into reality. And so, like, that's why we're here. But this brings us to the $1 billion question, Sam. And it doesn't have to be anything to do with your company. You're an ER doctor, you're a human person. You may have seen a whole lot of other issues in healthcare too, but you just feel free to answer as you see fit. The question I ask every guest on the Nurse Rosa's Insights podcast is, if you were given a grant for $1 billion to meet the needs that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact? What
So
would your answer be,
my
Sam?
answer kind of meets both sides of the question. As an ER doctor, I see access to medicine is the most difficult part of medicine from at least my perspective and probably perspective of others. But people don't know where to go to get care. They don't have the insight to know one hospital has a neurosurgeon and another hospital doesn't, even when they need those things.
True story.
And so and it's difficult to, I'm going to say, advertise those things, let people know, because everyone wants someone at their hospital.
Yeah.
And so I think that giving people access to the appropriate care, not just access to care that's not individualized, is one of the most important things in medicine. And so if we could create or spend the money creating a world where every individual gets the access that they specifically need, then healthcare costs would go down. Even though that seems very expensive, they would go down in the long run
Right.
because people are where they're supposed to be. You know, we see so many times in my emergency department that, people didn't go to the pediatric hospital, and I can treat everything. I love children. I love treating children, but sometimes you do need a pediatric hospital.
Yeah. And they
Uh,
have all the tools to
they
work
have
with
all
that
the
are the right size,
tools.
right?
They have the nurses who love to do the tiny baby IVs.
You need that.
You need that. And giving people the knowledge to find that access is
Yeah.
so huge. And so with $1 billion, being able to give people the access that they actually need for their small and their large issues. I mean, we're seeing so many of these direct medical companies coming out, bridging some of that gap, but
Mhm.
people don't know about it, or it's too expensive for them.
Yeah.
And so creating a world where people have what they actually need is huge. That's one of the reasons I created Bounce Back Smart, is being able to give people this professional athlete performance tool in your pocket that is affordable and functional and can get you back to your work, get you back to what you love, get you away from being debilitated by your injury, I think would bridge some of that gap for people. And so that's what I would do with $1 billion. I would give people the knowledge and exposure to what they actually need.
I love that answer. And I'm a big fan of telemedicine. I use, in our system, we use my chart, and I use that thing all the time to talk to my primary care or any specialist. It saves so much time and prevents having to go to different appointments a lot of the time for things that they can just answer through a direct message.
Exactly.
So using the tools that already exist that people maybe not know when to use them. I love to raise awareness about that as well. So, yeah, I think that meets a huge need when it comes to access.
And I think
So,
people
yeah,
outside of medicine don't we get to communicate with each other about what do I need and what can happen next. And I have a friend who can get you into an orthopedic doctor and all of those things, but the average person doesn't have that opportunity.
yeah,
So
that breaks my heart. Like, I wish strings didn't have to be pulled to get people the care that they need. And it kind of makes me nervous. Like, what if I'm not in a position one day to do that for myself or my family? How are we going to get access? So I really want to help build the tools and put the processes and systems in
yeah.
place to make access more accessible to people no matter what they need in healthcare. So thank you for being part of building the solution, Sam.
Thank you.
I really appreciate you thinking outside the box and not limiting yourself of like, oh, I'm not an expert in that. Well, guess what? Nobody is, especially when it comes to this AI stuff. We're all learning this together and it's just growing and exploding. So if you think something, try it out. We got to hear from Mark Cuban last night.
Yeah.
You know, were you there? Did you
Yeah,
get
it
to
was
listen?
great.
Oh man, and he was talking about it. If you have an idea, ask ChatGPT, you know, or whatever LLM you like to play with. Has this idea ever been done before? And if there are things like it, find out if it's really doing what you think it needs to do. And then if it hasn't been done already, jump on it. Ask it what would be the next step to starting it. And
And if it's
that's,
something that
yeah,
you need, other people might need it too.
for
And
sure.
it might not be out there. That's what I found.
Right. Like my mama told me I'm special, but I'm not that special. If I need something, somebody else is probably going to need it too.
It's true.
You're right. So, for our listeners, if you've enjoyed this episode of the Nurse Rosa's Insights podcast, please like and subscribe wherever you're listening. If you know somebody who has a great answer to the $1 billion question, please put them in contact with me. You can reach me on social media at Nurse Rosa Speaks or email me at which is info@nurserosaspeaks.com because I would love to talk to them. And I will see you in the next episode.